5 on Frontline, produced by AIHA. This week, we're exploring a challenging question that impacts millions of Americans. What happens when a natural disaster occurs during the COVID-19 pandemic? How can volunteers, businesses, and workers protect themselves and their loved ones? Our guest today is Ed Primeau. Ed is the past chair of AIHA's Incident Preparedness and Response Working Group. He was an editor of the second edition of the Incident Safety and Health Management Handbook and just retired from the United States Coast Guard's Atlantic Strike Team, where he worked for the past 17 years. He's a National Incident Management System Type 1 safety officer. During his time with the Strike Team, he responded to numerous multi-agency responses, which include major hurricanes, the release of hazardous materials, and oil spills. Welcome to the show, Ed.
Good to be here.
Ed, we are in the early months of the Atlantic hurricane season, which is projected to be above average in terms of activity. And already we've seen wildfire outbreaks throughout the nation. People are being evacuated, businesses are being forced to adapt, and workers are facing numerous hazards. And volunteers are doing their best to help with disaster preparedness, response, and recovery during the pandemic. There's a lot of hazards during normal times, during the pandemic. Even more. So Ed, you've got a lot of experience. I'm just going to ask you straight up, would you feel comfortable deploying as a volunteer during the pandemic? And maybe you could kind of walk us through a scenario.
Well, Mark, yeah, I would feel comfortable based on what role I'm going to fill. I look at the greater good, and I would do the risk assessment and look at my own health and what I'm going to offer. And so if the risk assessment, if the gain is there, then yes, I'm going to volunteer. But, you know, there's going to be a lot of differences in responding during COVID than normally. When I was at Hurricane Maria down in Puerto Rico, the command post was in the ballroom where we were packed in, all the responders to manage the response. We won't be able to do that during COVID. We're going to have to think outside the box. We're going to have to look at ways of creating that social distancing and to prevent the spread of COVID. So instead of having everybody in the the ballroom, we might put different functions in rooms where we're only going to have 2 or 3 people in the room working with face masks and other preventive measures. And then having meetings that we need to have through either Zoom or conference calls, or going outside and having those meetings where we have to have people, but still maintaining the social distancing and preventing the spread of the disease. So it's going to really take thinking outside the box, and that's really where everybody should be looking at their plans now to see what can be done to maintain that. How is it going to affect their response posture to do that? But as a volunteer, you look at what you're bringing forward to it, and you have to look at how you can best protect yourself.
Sure, it makes sense. I'm hearing a lot of the similar recommendations that have come out of other governmental entities, and I know that AIHA has a lot of resources on our website, some of which you've helped author. I wonder if you're a business owner, if you're a worker, what additional considerations do you need to take into consideration during the pandemic? If you're evacuating to a mass care shelter or something like that, what's some of the things that these types of folks should know? I know that's a broad audience.
Well, for businesses, like I say, you know, if you have a plan, look at your plan now. In my experience on responses, the thing that led to a successful response was relationships. And these relationships were usually developed before the incident happened. So look at that and communicate with your local public health, and also your local occupational safety and health science professionals. Get them involved and see what you can do to prevent the spread. You know, businesses have been really innovative in doing this during the COVID-19, leveraging technology and using that. Now, there's going to be challenges in a natural disaster like a hurricane, because you might have infrastructure outages, supply chain interruptions. So look at what you need to continue your business and see how you're going to be able to source those if that happens. And if your power goes down, your connectivity goes down, how can you still do that? And like I say, can you do a meeting outside instead of having everybody inside? For the worker, the thing that they should really look at is planning to take care of their family. How are they going to be taking care of their family? Because one thing we don't want is workers distracted by worrying about their family on a response, because there's a lot of additional hazards and they really need to be focused at the task at hand and not worrying about their family. So make sure you have a plan to take care of your family, and also educate your family now about what that plan is so that everybody knows what's going to happen. If you're a hurricane, where are you going to relocate to if you live along the shore? How are you going to do that? You don't want to end up in a shelter, but also too, a lot of the people that establish these shelters are looking at ways of spreading it out so that they're not putting everybody in one location.
That is fantastic. I really appreciate that advice. That is all the time we have today. Thank you so much for coming on the show, Ed. Really do appreciate it.
My pleasure.
And thanks to everyone for joining us. This has been 5 on the Front Line. I'm Mark Ames. We'll see you next week.